June is National Men's Health Month, and before we let the month get away from us, we wanted to focus today's checklist on some important questions that guys should be asking, some concerns that we should not ignore. And to do it, we brought in the very best. Dr. Vin Gupta, he's a pulmonologist. He's also an NBC News medical contributor. Always great to have you. Thanks for coming in.
Thanks for having me.
So let's jump right in and talk about a topic that a lot of guys do not like to talk about. Low testosterone. This is something that affects millions of guys. What are some of the symptoms of low T?
You know, Craig, we don't talk about this enough, exactly to your point, but they're common symptoms sometimes. Feeling down, just feeling fatigued, and decreased libido. But usually it's a constellation of these symptoms, not just one, but maybe a combination of them that would say, okay, maybe we should get somebody checked out and really dive deeper here. But it's a constellation, not just one of these symptoms.
So decreased libido, chronic fatigue
and depression, and really just feeling down potentially. And so that, especially if it's chronic, maybe even for a month to 2 months, if we're seeing that chronicity, that's what we want to say, talk to your doctor. If you don't have a doctor, get primary care and have that conversation.
So that's the advice. That's the advice that you would give.
And so really it's about seeking medical guidance, considering testing. And so this is where the conversation with your provider is really key. We don't have enough conversations with our providers, especially men. They don't really talk about feeling down, their energy level. And often what ends up happening is they may self-treat. We're seeing a lot of people just go on, say, read something on the internet where they say, maybe you should take some testosterone. That's what we want to say. Don't do that without actually getting advice from your medical provider, maybe even getting tested. Getting tested is critical because if you need testosterone, the right dose is important.
Replacement therapy.
That's right.
Okay, Mr. Roker's got it.
And by the way, we have the Gerber baby already here, so if you're hearing sounds, normally I would say that's Craig, but you saw him on camera.
Still could be. Still could be.
Could be any day now. So men and prostate cancer, something I know very well. What do we need to be looking at?
You know, Al, you know this very well from personal experience, and exactly from that, we want to build awareness on when people should get tested, when they should get screened. Now we're really saying if you're 40 years of age and up and you have a family history, if you're African American, if you have a combination of those, if you're African American with a family history and you're 40 and up, talk to your doctor about whether you should get a PSA screen, that lab test that, frankly, there's a lot of controversy on. Should we get screened? Should we not? I'm a big believer that you should have that conversation.
Because don't you need to have a kind of a base so that your doctor knows?
Absolutely. You want that base because then you can see the velocity of increase. Is it increasing? How fast is it increasing? So it's important to have that conversation.
Okay. One of the things I've taken a multivitamin now for a while since I turned 60. What's your take on the multivitamin thing?
You know, I'm a big believer that we should all be taking a multivitamin, at least, again, at that 48 years of age and up. That's really when we are starting to see more and more studies saying, gosh, maybe there's a benefit for cognition. Maybe it actually can help prevent cancer. And these are some of the studies that we've seen recently amongst men. And so what really matters here? Choose the form that you're going to take. You know, a lot of people say to me, hey, doc, I want the Flintstone variety for adults. And, you know, that doesn't exist, but you can take gummies. There's liquid forms. Sometimes you don't want to take a pill. Read the label. The FDA doesn't necessarily regulate this space, but third parties do. So see if there's a certification. Look for vitamin A, B, and D, maybe calcium as well. That'd be a nice add-on. And really, that's the
because I take one that says for men. Is there a difference?
You know, if it says for men, usually it's going to have the key vitamins. So you're going to want to look at that labels to make sure those vitamins are accounted for.
Thanks.
All right, we have a couple minutes left. Let's talk about protecting our skin from the sun. We talk about it with women and eye creams and all sorts of things and face creams, but men too. We all have skin.
Yes, we do.
Not immune.
You know what we've seen, Chanel, is that men just don't put on sunscreen as much as women, and so that's the key here when we're talking about this high rates of skin cancer. Men, you got to wear your sunscreen, and again, just like with multivitamins, buy the sunscreen that you're going to actually put on. So if it's spray, you got to spray it in. If it's lotion, you still got to rub it in too. SPF 30 or higher, Chanel. Broad-based. You want to make sure that you have broad coverage here, and really just invest in protective clothing and try to avoid peak sunlight.
Okay.
And another one I can relate to also, lower back pain. What do we need to be mindful when it comes to that?
You know, Dylan, this is such a source of just ill health and people not able to do the things that they enjoy. And so this is something that, in terms of symptoms, dull aches, stiffness, limited range of motion, you're not really able to do the things that you want to when you wake up in the morning. So what do we do to really try to combat that? It's important to still stay active. So over-the-counter medications, things like Tylenol, acetaminophen, ibuprofen. Those things can be really important. Heat, especially if it's chronic, can help with blood flow, make it try to make you a little bit more mobile.
And you say there's an exercise too that we can all kind of
There is
do.
an exercise, and there's an exercise. If you come in here, really what you want to do is in the morning, you want to try to twist your torso there. Really what that's going to do is just open up those muscles, increase that blood flow.
What if that hurts?
And if it hurts, then what you can do a modification where you're just leaning in and just doing side to sides when you're doing the lean in.
But move the back, basically.
Move the back.
Move it or lose it.
Dr. Gupta, thank you. Great tips.
Good stuff.
Happy Men's Health Month.
Yeah,
Thank
even though
you
it's the
so
end of the
much.
month.
I think I got some more
We
days.
squeezed it in. We got you covered.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.